Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Famotidine. Its brand name is Pepcid. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Famotidine is a histamine H2 receptor antagonist. It primarily inhibits the concentration as well as volume of gastric secretions. In terms of indications for use, this medication is indicated to be used in the treatment of gastroesophageal reflux disease, or GERD. It can be used for gastric hypersecretion, as well as in the treatment of a duodenal ulcer. And we often see this medication used in the treatment of indigestion. Now, before somebody was to use Famotidine, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. We wouldn't give this medication to patients who have a history of hypersensitivity when using other H2 receptor antagonists. As well, this medication will be contraindicated in patients who have a hypersensitivity to Famotidine or any other component of the product. Now, in terms of precautions, this medication is on the Beers criteria, which is a list of medication that the elderly population should either avoid or use cautiously. We would want to avoid giving this medication to the elderly population who are at risk of delirium, as H2 receptor antagonists may worsen or induce delirium. CNS reactions, including confusion, hallucinations, delirium, disorientation, agitation, seizures, and lethargy have been reported in the elderly population, as well as in patients who have renal impairment. We would want to use this medication cautiously in patients who have moderate to severe renal insufficiency due to the increased risk of a prolonged QT interval, as well as some of the CNS or central nervous system adverse effects that I just mentioned a moment ago. In these patients, sometimes a dose adjustment is recommended. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Famotidine or Pepcid, they can expect to receive their dose orally. If Famotidine is being used to treat gastroesophageal reflux disease, or GERD, the patient would typically use 20 milligrams about twice daily for 6 weeks. When using the oral formulation to treat gastric hypersecretion, 20 milligrams would be given every 6 hours, and then the dose can be increased based on patient response. The maximum dose in this setting would be 160 milligrams every 6 hours, and the treatment can last as long as clinically indicated. If they were given the IV formulation, they would typically be given 20 milligrams intravenously every 12 hours. For indigestion, a patient would typically use 10 or 20 milligrams twice daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Famotidine, so I'll go over some of those here now. Constipation and diarrhea happen about 1.5% of the time. Dizziness comes in at a percentage of 1.3%. 1 to 5% of patients may experience a headache. Now, some more rare but serious side effects would be some dermatological side effects such as Stevens-Johnson syndrome or toxic epidermal necrolysis, rhabdomyolysis, angioedema, and less than 1% of patients may experience a seizure. That's all we're going to talk about today with Famotidine or Pepcid. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.